Good day, everybody. This is Dr. Jeff from the Joint Chiropractic. I've got a friend of mine, Mr. Gregg McDonald. He's a Bowen therapist. A lot of people are always ask me the question, do you know a good Bowen therapist? Well, now I do. I know a great one. What is Bowen therapy? These are the sorts of things that we're going to talk to Gregg about here briefly. He's going to share with us what he does and why he does what he does. Gregg, you practice in Chermside,
Yep.
Cleveland,
Yes.
and Redland Bay, correct?
And Belimba as well.
Belimba as well. Thank you. So, Gregg, please, what is Bowen therapy for those people who don't know?
Yeah, good. Thank you for asking. Thank you for having me. It's hands-on work. A lot of people, hear of a lot of different therapies and they go, is it spooky? Is it this or that? No, it's very hands-on work. It's musculoskeletal,
Yes.
joint and nervous system body work.
Yep.
And so the Bowen therapist actually applies a rolling of muscles and tendons and other areas of the body with his hands so that it's light work, it's not hard work, it's not heavy work, but it's hands-on work and it helps the muscles return to their relaxed state.
Right. Excellent. Okay. How does it work? What's going on when you do your
Yeah.
what you do?
Okay, look, it's a little bit technical, but I'll explain it, and I love explaining this. Around our muscles is what's called fascia. If you ever have a look at a side of a leg of lamb, and you can see the different muscle groups,
Mm-hmm.
and around those muscle groups you see sort of a sheath of some sort of skin that's sort of whitish.
Yes. Yeah.
That's
yeah.
fascia.
Yes.
Too late for the lamb, however, for you and I, it's awesome because that fascial tissue has a memory. The Bowen therapist says, take your muscles, which is has the fascia around it, take your muscles back to where they belong, back to where they're relaxed.
Yep.
And one of the great things about Bowen therapy, I think, is that it's great for athletes.
Yes.
My oldest client is 90. My youngest client's been 6 weeks old.
Is your 90-year-old a athlete?
I think he wants to be.
He wants to be?
So he keeps coming back.
Wants to
He's
get-
actually doing well.
Good.
He's actually said, no, I'm not having that knee operation. My knees are fine.
Good.
So which is
Wow.
great. Yeah.
I've been in practice chiropractically 22 years now, and I've always bumped into lots and lots of people throughout the years who have utilized Bowen, and they've always asked me if they know a good Bowen therapist, and people have always raved about the wonderful effects that it has given them. Now, Bowen, is it heavy, like a deep tissue massage? Is it gentle? What's it like?
Generally, it's very, very light, Jeff. Sometimes there are pretty, spicy moves where they can be a little bit delicate. A lot of it has to do with a person if they're very sensitive or not.
Yes.
But generally speaking, it's very, very light work, and it's not a lot of pushing, or it's not like massage where there can be, or remedial massage where you're actually taking the muscles and making them go back. You're actually just signaling to the muscle, take your own muscles back to where
Wow.
they belong.
Right.
Yeah. And actually, incidentally, it works wonderfully well as a complement to chiropractic work.
Sure.
As well,
Sure.
which is good.
Nice. Excellent. What got you? Why did you become a Bowen therapist?
My wife made me do it.
Right.
She many years ago, she had jaw problems. She had scoliosis, which is a curve of the spine, and she was just down for the count. What do you do? And I said, look, I had a full-time job then. I said, you got to be the best doctor. You got to find out what's going on. You got to go all the different doctors and make up your mind how you're going to do that. One of the things she came across was Bowen therapy. So we didn't know what that was. So this was about 20 years ago. So go and do that. Go and try that. She started to get some great results. So all those massive headaches from her jaw being out, and her back being out, and her hips and all that sort of stuff, they started to dissipate very, very quickly.
Mm-hmm.
And that scoliosis, what we found is somewhere between the first 2 years and the first 10 years of the occasional treatment after for 6 months or so, that the doctors actually said about her x-ray, they said, you no longer have any recognizable scoliosis.
Wow.
So the muscles kept pulling everything back into alignment over a period of time, and the scoliosis has disappeared. She's much better quality of life. Her jaw, which is kind of, she's kind of born with that, so it's really hard in the sense that her jaw still goes out sometimes, but her headaches are down to, well, I'm her biggest headache, really. So,
I can see that. I can see
take that out.
Yeah.
I cut that out.
All right. What's Bowen therapy good for?
Okay, so nervous system as well. So if somebody that has a lot of depression, a lot of anxiety, and even it's very, very good for things like autism as well. A lot of people don't know it's not a cure for autism, but it does help relax the whole nervous system, so the body then copes better with what it has to deal with.
Sure.
But, and it's great. It's great for carpal tunnel concerns, neck problems, shoulder problems, hip, back, lower back, knees, whatever it is. So it works very similar a lot the way you do with the chiropractic work.
Okay, excellent, excellent. Well, fabulous. Greg, what's the best way for people to get in touch with you?
Go to my website, www.bowengetbetter.com.au, and my cards are here at Jeff's clinic too.
Okay, so we're going to put this down at the bottom of this little video here. You'll be able to see his contact details and a little bio here from Greg. Guys, Bowen Therapy, if you're keen, this is your man. I'm Dr. Jeff from The Joint Chiropractic. Have yourself a wonderful day.
Indeed.